Health insurance is insurance against the risk of incurring medical expenses among individuals. By estimating the overall risk of health care and health system expenses among our targeted group, an insurer can develop a routine finance structure such as a monthly or annually premium or payroll tax to ensure that money is available to pay for the health care benefits specified in the insurance agreement. The National Health Insurance Scheme (NHIS) is established by the federal government via Act 35 of the 1999 Constitution to provide comprehensive health care delivery at affordable cost. The program has been designed to cover employers of the formal sector, self-employed as well as rural communities, the poor and the vulnerable group. The idea of the NHIS is for the universal coverage in order to improve the health status of Nigerians. However, till date, less than 5% of Nigerians are currently enrolled in any form of health insurance. Only the federal government employees and a small proportion of private sector workers have been covered. By implication, the majority of Nigerians can hardly afford basic health services. Those who can pay out of pocket, while others patronize unregistered medical outfits and traditional healers for healthcare services. Repositioning equitable access to comprehensive health services REACH, popularly known as Rich Nembe Project, is an initiative of Shell Petroleum Development Company (SPDC) in collaboration with Nembe Community Development Foundation (NCDF) and Bayelsa State Ministry of Health towards easy access to health services by the people in Nembe community. The Rich Nembe project is geared towards developing and implementing a viable community health insurance scheme, CHIS, for the indigents of Nembe Kingdom, with the focus of overhauling the Nembe General Hospital.
We are really proud to be associated with this kind of program that touches the ordinary people in the community, programs that ensures that people have access to quality assured care, that will improve their quality of life and make sure that they are healthy and they are productive. So we as a company, we are really proud to be associated with this program.
Nembe is a local government area of Bayelsa State, Nigeria, with a landmass of 760 kilometers square and a population of 130,931, according to the 2006 census. Nembe General Hospital was established in 1980 to provide quality secondary health care services to the surrounding communities. Earlier, before the implementation of the Rich Nembe project, service delivery had been hampered in the hospital by several challenges, which were not limited to infrastructure, staffing, implementation capacity, commodities and logistics, hence the Rich Nembe project.
Nembe people are really very passionate about their health care, so they approached us and we agreed to work together. So the Nembe people, the government of Bayelsa State, working in partnership with Shell, and that is how the Nembe Community Insurance came about.
The foundation is, if you will, the cluster body that has an understanding, what we call a GMOU, between SPDC on the one hand and the Nembe community. And NCDF is the body that represents the Nembe City community in the transactions with SPDC. The role of NCDF is, if you will, the financier. Each person, each community member that participates in the program is yearly supposed to pay the fee of 7,500. Now, the individual's contribution in this scheme is 1,500, and the 6,000 is brought out from the pulse of the foundation. That is the cluster as a whole. And that makes the 7,500. And that is the funding per client for 1 year of this program. And so that is the role of NCDF in the scheme. We finance the bulk.
Basically, you've done so well in that community and particularly in the general hospital. One, improvement of the health service facility delivery in the general hospital. This we were able to do in the sense that by now we have many services that are now obtainable in the general hospital. For instance, the digital X-ray, which is already on ground, the ultrasound, and some biochemical and hematological profiles, which have not been running in the facilities. But with the Reach Nembe project, all these things are on ground. And apart from that, we also talk about training and seminar programs for health workers in the facility, and even going as far as outreach programs into satellite community in Nembe, within Nembe environment. Then also revamping and overhauling of some of the dilapidated structure in the facility, so as for the effective smooth running of the health service delivery. Then apart from that, other thing, in fact, also the employment of more staff for the effective and efficient running of the facility. Then one other very important area which the Reach Nembe project has done in that general hospital Nembe is increasing the number of clients accessing the health facility. This they do by way of subsidizing and sometimes free services to the clients, and which naturally they won't have able to come to the hospital because of financial constraint.
Now the one that's happened, the community health insurance scheme, that was marvelous to the people. It made a lot of people who do not have access to healthcare delivery possible. Lives were saved. The hospital that was constructed, as I have said earlier, 1980, was renovated, and a lot of changes came in. Formerly, X-ray department was not functional. Right now, it is functional. Ultrasound system is functional. Staffs that we are lacking, we are employed and trained. And you know, training of staff is a wealth to a society. It makes the work easier and well-informed society.
NCDF, through the instrumentality of SPDC, said that we have to do a community health insurance scheme, like what is being done at Obiakpo. That the number one thing that, apart from doing all this social infrastructural program, if you are not healthy, there is no way one can say you go and not play football or play or do sports or do anything. So the health is the actual wealth of the people. So NCDF decided to renovate the hospital. We took permission from the state government, write letters to them, and they said give us the go ahead. State government has been planning on their own to renovate the hospital, but every year they put it in the budget, it doesn't work out. So it is a big plus for us. Or in fact, we have to even have the will to go into complete renovation of that hospital.
Reach Nembe project, launched on November 7, 2013 by Shell, covers a cluster of 10 communities under Nembe, which are Nembe City 1, 2, and 3. Eweleswo, Ibetaiwama, Kiripogu, Iwama, Etiema, Nembe Creeks 1, 2, and 3. Sabatoro and Fantuo Community Trust. The scheme now has over 10,000 enrollees with a total utilization of 4,834 enrollees.
I really thank Shell for this program that they are doing for Nembe here. Really, the thing helped a lot. Like me and my wife and my family really benefit on this very program because it helped a lot of people that have pregnancy, people that are sick, a lot of things. You know, the area is very difficult to have money quickly, but definitely when this program starts, it helped a lot of people. Even my life, when I got sick, it really helped my life. So I really thank Shell to continue this program from time to time. Thank you.
I appreciate the Shell that has made it possible for us. Like most times, there will be no money to carry people to the hospital, but this time around, once the child is sick, without wasting time, you come and benefit from it. So I'm happy over it. Thank you.
I thank the Shell for the great to give us this opportunity to benefit this something. I thank them. That's the thing I have to say.
Nembe General Hospital is one of the 27 health facilities supported by Shell Nigeria in 6 Niger Delta states in its community health care scheme. The first Shell-supported community-based health insurance program in Nigeria, being the Obio Cottage Hospital, Port Harcourt, Rivers State, was formally launched on March 25, 2010.
Started with the community health insurance scheme in Port Harcourt using Obio Health Center that belongs to the government. So it's a public-private people partnership that people pay a small amount of money, and when they are sick, they go to that hospital and to receive care without paying out of pocket. So with that Obio, what we call the Obio model of care, we think that we have created a model of healthcare that is sustainable, that is scalable, and that is replicable.
Reach Nembe project is managed by Insight Health Consulting Limited.